So Dr. Donohue wanted to work on some stress he was feeling in his heart. He's feeling a little fluttering. He's got a little muscle spasming, I guess you call it, going on. Twitching. Doc's been a patient for a while, so we kind of already know where we want to go with him. We've worked with him before and we got some good results. But it's been about 5 months since we've seen him. So something crept back in that we found on the heart sound. We're giving him some nutrients to kind of work on it. We're going to see how much work we can get done with just the nutrients. And then after that, we're going to do a nutrition response testing examination. So we're just going to see how much we can handle just giving him nutrition based on the heart sound recorder. So we'll be back in a second. So we just took care of Dr. Donohue. We put him on the heart sound recorder after he took some Cataplex B, Cataplex G.
Yep.
Okay, so Cataplex B and Cataplex G. The goal was to calm down the second heartbeat, and it worked.
Yeah.
So, look.
Wow. Amazing.
So you're calming yourself. The other thing that you did, this was your aortic valve. Look at all the extra activity going on in the valve.
Yeah.
You calm down.
Okay.
All right. So what we need to do is he tends to run fast. So even when you're doing the right thing, you run fast.
Mm.
I think it's an occupational hazard being a chiropractor. We just run fast. Right, so what we're going to want to do is we're going to want to just slow the heart a little bit and give it something to calm it so that it will reset itself. And it seems like you like that because you're already calming yourself and just chewing up it. So he was able to calm his heart down in just 3 minutes chewing the right nutrients. Now we're going to get a little bit more specific. We're going to go into the nutrition response testing. We're going to figure out what's going on with this twitching response that he feels going on in his body. So we'll see what nutrition response testing shows us. So, watch what I'm going to do now. So Neil, please. Okay. So you're going to bring your arm up to me. You're going to lock your elbow. You're going to gently match my pressure. I can definitely see where you lost weight. Definitely did a good job on that.
Thank you.
Yep, I see a big difference. Just enough to match. Don't work so hard.
You do this all day.
So you're not blocked. That's good. You're open to healing. Not yet. Good. Open this hand and touch that pinky and thumb together. Open that hand. Okay, so that indicates that his nervous system is open to healing, which means he can heal himself when he gets what he needs. So we're going to figure out what it is that you need, if anything. So one more practice test. Just enough to match. That's perfect. That's it. Perfect. You feel it. Just stay the same and let your body tell me what you need. Okay, so his heart still tests weak, even though he just ate Cataplex B, which means there's something else that he wants for his heart. And I am going to check your blood pressure reflexes also to see if there's a problem in there. Okay, his blood pressure reflexes are weak as well. And you mentioned, is it this hand or is it?
Yeah, we do.
So right around the webbing in the thumb?
Yeah, and my finger will actually
Okay.
move when it
Alright, so he's weak in his hand between the thumb and his index finger is weak, but this is strong. So it's really this and this, and it's not on this hand. It's
just
only
like-
that hand.
yep.
All right, so we found a couple of things that he wants to work on. So we're going to figure all this out for you. So let's see where the priority is.
The last thing, Doc, was
Yeah.
pectoral. Was a little, but not as often as it.
Twitchy?
Yeah, a little twitchy.
Okay, so
Okay.
so we're talking like up in here
Yeah,
by
right
the
there.
insertion.
Yep.
Yeah, that's weak.
Okay.
So we have to determine whether that's heart or pec muscle. So we'll figure all that out right now. Okay. All right, so the priority is heart. So we are going to evaluate heart now. So we're wearing a different hat here. So we already worked on his heart on that table or with that instrumentation. Now we're actually looking at his heart from the perspective of nutrition response testing to see if there's anything else that he wants us to give him. And the whole idea here is to restore strength. We know his blood pressure's off too, so he's probably going to want some Cataplex E2, but we'll see where it takes us. So let's start with Cataplex E2. That's Cataplex G. which is not strengthening the heart itself. Here's Cataplex E2. That brings back strength here and fixes the blood pressure reflex. So he wants oxygen in his heart muscle, and you want oxygen to handle pressure in the body. That's what Cataplex E2 will do.
Okay.
We are definitely going to keep him on Cataplex G, Courtney, and we're going to absolutely give you Cataplex B because that's our basic for everything else. Now I'm curious to see if we oxygenate you, if it fixes this or not. All right, so let's see what happens. All right, so that's not fixed yet, so that's still not fixed. So let's see if that's even a priority. Okay, so it is prioritizing. So we're actually going to evaluate it like it's a reflex. And we're going to see if there's anything going on that's causing this. I suspect it's minerals, deficiency somewhere, which we're going to evaluate in a second. But we're just making sure there's no chemicals, metals, toxins, infections, which is not showing up. All right, so we're going to see if it's a calcium transport problem, and it tests that it is. So we talked about that before, and he is mineral deficient right now as we speak, and he needs more minerals too. So I would think he wants more calcium.
He's on calcium.
Two,
He's
two,
on
and
calcium.
three.
Okay, you're probably going to be taking more.
Okay.
Nope, that's not solving this. So he wants probably magnesium then. That's what he wants. All right, you want all the basics, Neil. You want calcium, magnesium, and you want transport. And that's going to fix everything. All the twitches and fibrillation. Probably going to calm the heart too.
Yeah.
So we're gonna work with you over the next month or two. You're gonna start fixing yourself, but I promise you're gonna come back. You're gonna feel like a different guy, and it's mineral deficiency.
Amazing.
Simple stuff. So now we had the other products that you were on last time you were here. We had you on Prostex, Imuplex, Cardiotrophin. So we had you on like a lot of heart nutrients, and you may or may not want to blitz yourself with more, or you may want to change, but we're gonna find out right now.
Tell me.
So you like your program. Yeah, it seems like you want to do it. All right, so he's actually testing for more nutrition, and he wants to blitz his body with 3 or 4 or 5 different heart nutrients, and he wants huge amounts of minerals. So you want a lot of basics. But what he doesn't have is infection, toxins, chemicals. He's not sick. You just need nutrition.
Okay.
And you're going to fix everything.
Sure.
So what we're going to do is we're going to dose brand new and fresh on everything. So it's a perfect program, all right? Because
Okay.
I haven't seen you in like 5 months.
It's been a while.
So let's have you make your hand like a cup. And again, Doc's been a patient for a couple of years, and he's been doing great, but he was kind of on a maintenance. And we've had a 5-month span between when we saw him. So we need to tweak the program and just get it, perfect for this point in time. Okay, so on Cataplex G, he likes 4 a day. And again, at least everything is perfect for you at this moment in time. We'll redose him on Prostex. Okay, he likes 3 a day, Courtney. Now again, for those of you watching what I'm doing right now, this is an examination. This is what we do in here. So regardless of what the issue is, once we can communicate with the body and find out what it needs, we could get it to where it will fix itself. And in Dr. Donohue's case, we use 2 different modalities to figure out every single thing that he needs today. So I know for sure that we're going to be able to handle his heart. That's not even an issue. He wants 5 Cataplex E2 today. But because he does nutrition response testing as well, we found other things that the heart sound didn't show us, and we put everything together. So when you have a marriage of both things, you can't go wrong. So we fixed literally everything we could find wrong with you. Imuplex, which is a great antiviral. This is flu season. Everybody's walking around sick, but not Dr. Donohue because he's on an antiviral. 3 Imuplex a day. Okay, I'm going to redose him on Cardiotrophin. That's too much. 3 Cardiotrophin a day. And a Cataplex F is going to be something you become very fond of. So Cataplex F takes calcium from blood and puts it in all your tissues. You want more calcium transport.
Transport.
So you have good calcium in your blood, but you weren't sending it into your muscles. It needed help transporting. And that's what Cataplex F will do. It'll transport all the calcium you need to all your tissues. Okay, so he likes 4 a day on the Cataplex F. Cataplex B is probably the most important heart supplement because it just gives you the raw nutrients to build a strong heart. Create good tone, create good electrical impulse in the heart as well. And you've been on this for a while, so you're still testing that you want more of it. Good catch. There we go. All right, so you're still testing at a good number of these. He says 6 a day, Courtney. And then the last, you just want magnesium. You know, you're probably getting enough calcium, but you need a little bit more magnesium. Magnesium will help with the absorption of calcium, and very important, it's right below the importance of calcium in the body, probably one of the most, or the highest levels of mineral nutrients that we need, and you want more of it. So he wants 3 magnesium a day. I mean, all minerals, just a lot of minerals, and good heart support, and you'll be good to go. All right, so he's all set. Come on up. Oopsie daisy. And you know, and it's funny, what many would think is a complex case is not a complex case. It's just a matter of having the right modality to figure out what you needed. And we got value from both our graph and from nutrition response testing today. That's why I encourage you, don't do one or the other, do both. So you never miss anything that way. That's why he'll be fit as a fiddle within a few weeks. He'll feel great. Okay, thank you very much for helping us out. I appreciate it. All right, all of you. We'll talk to you soon. This is Reverend Dr. Inola from the North Isle Wellness Center of Hope in Miller Place. Talk to you later. Take care. Bye.